Good morning, everyone, and thank you for joining us today. I'm Dr. Velasquez, Health Officer for Spokane County. And as you may have heard, and hope you have, we're celebrating National Public Health Week this week, from April the 6th through the 12th. And because of that, we want to talk about a little bit about national public health and some of the things we do in the community, because the theme for this year is Ready, Set, Action. And we're going to talk a little bit about some of the actions. So with me today, I have Melissa McDaniel, who's Director for our Community Health Division. And that is a division that is very much community-focused and community-centric. Pretty much everything they do touches the community in some way, shape, or fashion. So before we go there, I'm going to show you this, which was in yesterday's paper. Hope you can see it. It's an editorial. It says, public health workers touch all areas of community life. And I want to focus on that a little bit. Now, so I mentioned Melissa is in charge of community health. Mm-hmm. We have a number of other divisions that are focused on various aspects of the community, such as treatment services, environmental public health, disease prevention and response, and of course administration, where many of us reside. So good morning, Melissa. Thank you for joining us today.
Good morning.
So I introduced you as Director of Community Health. For the audience that may not be aware of what community health is, can you tell us a little bit about it?
Yeah, so community health is comprised of 5 programs.
Okay.
We have Nurse Family Partnership, HIV Case Management, WIC falls under that umbrella. We also have a Healthy Families program,
Okay.
which is our early supports for infants and toddlers, as well as our access to baby and childhood dentistry. We have Healthy Living as well, which I love this description. They describe it as everything from the twinkle to the wrinkle. So really looking at the life course.
Got it.
Yeah.
I have to think about that.
Right? Twinkle to wrinkle. It's really fun to say and a really cute description. It also really dives into the life course work, and they do a lot of systems work and health education out in the community.
I'm glad you mentioned all of that, because it does give people some perspective of the depth and breadth of programs. Mm-hmm. As you mentioned, from, was it twinkle to...
Twinkle to the wrinkle.
Okay. For those of us that don't have wrinkles, but, we understand what that means. So can you give us some examples of how the teams in your area really impact the community? What is that they do that people should be aware of?
Mm-hmm. So I think a really beautiful example is our HIV case management team created 100% of newly diagnosed cases within 2025 access to care. So they provided that linkage to care for 100%. That's the top in our state as far as percentage-wise goes.
Wow.
Yes, it was pretty incredible.
Can you repeat that top on the state?
Yes, we were
okay.
top of the state when you look at the data for linkage to care for newly diagnosed HIV.
Not that it's a competition, but it is important to us that we always try to excel
Absolutely.
and deliver the best. That is a great example. Yeah. Any other areas that you think will be interesting for folks?
Yeah. I think a really fun example is Nurse Family Partnership.
Okay.
They started a baby book club to promote early literacy and really support in that developmental stage for children and their parents.
Got it. And I think if folks that watch Facebook Live, we've had WIC in here for nutrition. We've seen the Nurse Family Partnership, some of the Healthy Living. I think over the last few years, we've highlighted a lot of the various programs in your division. Now, one of the things that I hear sometimes is what your team does may go unnoticed, because they're behind so many aspects of the community that either it's not noticed, or people may say, well, that only applies to some. Can you tell us a little bit about how is it that what the team does actually impacts the health of the whole community, not just some?
Yes, so I'm sure you've heard the quote, the whole is greater than the sum of its parts.
Correct.
And when you think about our whole community and those vulnerable populations that we serve, in order to promote access to care and promote the lifespan, a lot of the work that we do is really serving the whole community and the health of the community in that way.
Got it. So I'm glad you mentioned that, because I think sometimes when we look at the name of a program, we kind of narrow it down to, that only works with.
Yeah.
So when you talk, one of the things I remember, one of the conversations we had with the Nurse Family Partnership is how that impacts not only the immediate, but the family, the neighborhood, the community, with the work they're doing with that household. So, and I think that translates to many, many of your programs.
Absolutely.
So since we're celebrating National Public Health Week, and we only do it once a year, although the work of the teams happens every day, 365 days a year, as a director, what would you say if somebody wants to say thank you to the team, good job, or how can the community say, we appreciate what you do?
I absolutely love this question. So we work with some of the most humble and brilliant people that I have ever met. And I think one way to really celebrate them is to sit down with them and learn about what they do. Learn about how the work really shapes your life, the community's life, the business life within Spokane, and the community at large. And then share those stories. There's no greater form of appreciation than hearing somebody share how the impact or the work that you've done has impacted you and your community.
Wonderful. And I think having examples, real life examples of the work
Yes.
is always more impactful because it translates what you may be reading to, oh, that's what that means. I do have to say that we have received a number of emails and calls from the community. I actually received a phone call yesterday from, I don't have permission to say the name, so I won't, but it's a former mayor who is in her 90s right now.
Oh, wow.
Who just called to say thank you for everything you all do, and thank you for keeping all of us healthy and alive. And I was very touched by that conversation, because coming from someone that obviously has a longevity in this community, that
Right.
has seen everything we do for the last many, many, many years, it was very, very special to me. And we've had the opportunity to receive the 3 proclamations for National Public Health Week from the city of Spokane, from our county commissioner, and last night at the Spokane Valley City Council with the mayor and the city council. So I do want to say thank you to them, because these are our partners and support us in many, many ways. And as I was looking at the room last night at the city council meeting in Spokane Valley, 75% of the people that were there, either members of the administration or people in the audience, are folks, people that we have worked with
Yeah.
or collaborated with, which I think is one of the key elements for our effectiveness. We're only a couple of hundred people, but we amplify our strength by collaborating and partnering. And I know your team amplifies their strength by tenfold every time they go out there to do something.
Absolutely. Yes.
So anything else you want the audience to know about community health? Anything to be watching for as we go forward into 2026?
I don't believe so. I just think, when you learn about our stories and share those stories, that warms our hearts. And like I said, there are humble and brilliant individuals out there serving your community, and get to know them.
So let's repeat that theme of twinkle.
Yes. So everything from the twinkle to the wrinkle. So you think about that life course and lifespan of an individual. And that's really our target population that we serve.
And I think that's a great way to end today's show, from the twinkle to the wrinkle. I still have trouble with the wrinkle concept, but I also don't like to use the word senior or elderly.
Yeah.
But I do understand, and I think that phone call I received yesterday is a good example of how our teams actually impact everybody from beginning of life through the whole continuum into their later years. And we're very proud of being able to do that. We're very proud of the work that the team does. And if you haven't seen in the paper, we've been highlighting with pictures. I think today's picture is Kayla Myers from our immunization program. I think I saw it in today's paper, and she has been here many times to give us guidance and advice on immunization and so on and so forth. So look out for those photos, and I'm sure you'll see a lot of familiar faces. we've been flashing behind on the other screen some of our team that you see there in action doing various and sundry things, and you'll recognize a number of faces because they've been here to share with you what they do. So with that, I want to say thank you to Melissa. I want to say thank you to our team at Community Health. We happen to do a lot of things together because of their engagement in the community. And I want to say a special thank you to the team at SRG, not only this week, but for everything you do. I've been saying, as I accept the proclamations, that every team member comes here every day with some very specific thoughts in mind. What can I do today to make this community better? What can I do to help someone today? What can I do to improve somebody's life today? That's kind of like the mantra, and we see it every day. We see it in the work that you described, and we see it in the work that others may not see that is behind the scenes. So with that, happy National Public Health Week to all of our partners in public health all over the country and all over the world. And thank you to our team, and we will see you again next week. Stay safe, stay well, and by the way, it's pretty hot, so be mindful of that. I know that we went from winter to not winter, so we're all confused. But keep track of the weather because as it changes, make sure you're appropriately either dressed and or have sunscreen because the sun was pretty bright yesterday. Have a great day. We'll see you again next week, and thank you to Melissa.
Thank you.